As the United Nations COP15 Biodiversity Conference gets underway in Montreal, one solution to help the wild animals threatened by climate change may be to train them. In Sydney and Australia, a program teaches vets to respond to emergency situations. More details in this next report. Take a look.
Veterinarians are used to pets like dogs, cats and rabbits, but a lot less to wild animals. In Sydney, a new training program is providing all the tools they need to treat wild species.
What we're trying to do is really to help educate private practitioner vets and nurses so that they can better care for wildlife that comes to them. They're the forefront. They're going to be seeing these animals coming in all the time. And so whilst we can help as a backup, we really want them to be able to make good decisions for those animals at the time that they see them.
This is just one type of action that could help biodiversity in the country. According to a World Wildlife Fund report, 3 billion animals perished or were displaced during the 2019 to 2020 wildfires in Australia. That's where the vet course is useful, because most veterinary professionals only train to look after domesticated pets, such as cats and dogs, but not how to properly rescue and rehabilitate wild animals. The hospital hopes that by training as many professionals as possible, more wildlife will be saved, especially in times of crisis like the massive bushfires of 2019 and 2020.
We want vets and nurses to be able to recognise those animals that we can help and those ones that we can't help, that need to be euthanized on individual animal welfare grounds. And we're trying to increase people's understanding of all those specialised little sort of differences that there are between animals, because that plays such an important part in how we care for them, how we support them during their time in human care, and how best to get them back out into the wild, if that's appropriate.
The course is training vets in recognising species, what the care is for those species, how they can hospitalise them, what sort of environment they need to provide, how to feed and look after those animals, and also giving them skills to be able to make a correct assessment as to the animal's clinical signs. Developed with the help of the New South Wales Department of Environment, the NSW National Parks and Wildlife Service and the University of Sydney's Koala Health Hub, the course consists of a 20-hour online part with modules that can be completed over 3 months by participants. Before a one-day optional face-to-face intensive workshop, they are also shown Taronga Wildlife Hospital's facilities to see firsthand what post-treatment care looks like, and they perform a necropsy diagnosis, the equivalent in the animal world of a human autopsy. Since it started 2 years ago, nearly 1,000 professional veterinarians have completed the online course.
I think we have quite a lot of it around our areas, and where I live as well I get a lot of it, and I'd like to be able to know how to treat it properly. And with infrastructure coming in, everyone's like, all the patients are moving out of their natural habitats and coming into the city, and no one really knows what to do. So if you've got certain people that can specialise in it and be like, hey, I'm the person, it's really good to have specific people that know how to treat them and do it well as well.
We've lost something like 33 or 34 distinct species that used to occur here and nowhere else. And this has happened over the last couple of 100 years due to a combination of factors such as the introduction of feral predators. We've got feral cats, red foxes. There has been extensive modification of the landscape. Lots of habitat has been lost for agriculture, for forestry purposes.
Species extinction is high, especially in Australia, and catastrophic events such as bushfires can wipe out entire species in a short time. Bureau Report, WION World is One.
WION World is One is now available in your country. Download the app now and get all the news updates on the move.